Good morning all. It's me Soumya from Dreamport Atlas. In this video, I will tell you a nutshell theory on obstructive sleep apnea, and we will do one question with the obstructive sleep apnea. Okay. Obstructive sleep apnea, it is a sleep related disorder, but it can mainly affecting our breathing. Okay, that means from the term itself, obstructive sleep apnea, that means it is causing some obstruction. Because of that obstruction, the client is getting sleep apnea means cessation of breathing. Okay, so what is this obstructive sleep apnea means? The client is getting recurrent episodes of partial or complete upper airway obstruction. In the picture we can see that here this is the upper airway. It is starting from the nose, okay, then pharynx, larynx, here until here we can see here it's upper airway. Here we can see the soft palate, uvula, tongue also we can see in the picture. This is a normal breathing. That means there is no obstruction in the upper airway tract, and while when we are inhaling, the oxygen is coming into this, coming into and passing through the upper airway and into the lower airway tract. That means there is no much obstruction. Normal oxygenation can be happen. But see the second picture, there is some because of this is the tongue, okay, because of this tongue fall, there is some obstruction is happening, and the amount of air in which we are inhaling is not passing completely into the lower respiratory tract. See the picture. So at that time what will happen, the client will experience or client will manifest it as snoring. That is because of the partial obstruction of the airway. That is not an emergency, but it is signifying that when the client is sleeping, because of the tongue fall, the client is the upper airway is getting partially obstructed. But see in the third picture, because of this tongue fall, okay, this airway, upper airway is completely obstructed. Okay, completely obstructed, and here this the client's breathing got compromised because of the complete obstruction of the airway. The amount of air which is inhaling through the nose, as well as we are inhaling some amount of air through the mouth also, but this air is not entering into the lower respiratory tract, and client can't breathe when there is a complete obstruction of the airway, and that condition is called obstructive sleep apnea.